Welcome everybody on our today's session about the human balance. So today we will talk about the assessment and training of the human balance. My name is Gabriel. I will present you the introduction and then the information about the platforms during the practical session. And this is Roman. He will also present you the information about the software of using the platforms in the rehabilitation process of the patient, and then the information about the components of the platforms. So first of all, there is a question: why do we use the assessment and the training of the human balance? Balance is one of the most important aspects in the rehabilitation process, especially for the evaluation and training of the neuromuscular coordination, also for the weight distribution and balance. Nowadays, we use some modern platforms which are designed for the assessment of the balance and the proprioception, and they are intended in the use of the following rehabilitation. So we can use them in the orthopedics, neurologic, sports, children, and also for the assessment of the balance disorders of unknowing origin. So where can we use the balance? We can use them in the rehabilitation centers, in the physiotherapy facilities, also in the hospitals, wellness, and the sport clubs. As I mentioned, Roman, yes, we will talk about the 3 stages of rehabilitation, and they are associated with increasing the difficulties of the tasks which are done for the patients. So first of all, we use the stable, secure base in the first stage of the rehabilitation. Then in the second stage, we also measure the parameters, which are called the dynamographic parameters, but also on the static surface. And the last stage of the rehabilitation is by applying the unstable ground in our rehabilitation process. So just to summarize, we have this assessment and training of the balance, so the 3 stages of rehabilitation. First of all, we have the static conditions on the static surface. This is the first stage. Then the dynamic conditions on the static surface. This is the second stage. And also the dynamic conditions on the dynamic surface. But before going to the practical sessions and before going to talk about the software and the components of the platforms, it's very important also to know the key points of using the platforms, especially the Alpha, Gamma, and Sigma platforms. So first of all, we have the restoration of distributed neuromuscular function. We also use the biofeedback. So the biofeedback features that improves the proper load distribution, load shift between sides, move of body weight, also the pelvis stabilization and the activation of the weaker sides of the body. We have also exercises, so more attractive exercises designed, which helps to stimulate and improve the neuromuscular coordination and the reaction time. And the platform is also the excellent tool in the growing field of fall prevention. So we have the good diagnosis, proper selection of exercises, and effective rehabilitation procedure.
As you can see, we have here a platform Alfa. The components of the Alfa platform is Alfa platform with software, the stand with biofeedback monitor for patient, a laptop for therapists where we can adjust the test, the exercises, and the additional components of the platform is a big stand, big base with handrails, and the camera which can record what's happened on the platform during the test, during the exercises. As Gabriel mentioned you before, we have a good diagnostic here using the test. Static test, Romberg test, is an evaluation of balance with eyes open and eyes closed on the stable surface. Another test we can perform using the platform Alpha is a dynamic test, also known as limit of stability test. This is the evaluation of balance control during the dynamic sway on the stable surface. Another test is Unterberger test, also known as stepping test, for determination whether the patient has a vestibular pathology on the stable surface. And the last test we can perform is a weight distribution test, evaluation of load differences between sides on the stable surface. After the testing, we can use 6 exercises designed for patient rehabilitation using biofeedback. After the diagnostic by using the test, we can choose the different exercise which enable the development of individual rehabilitation program. Each of them has also many modifiable options so it can perfectly fit to the patient needs. Training can improve the patient balance condition before measuring the dynamographic parameters such as squatting, jumping and gait on the second and third stage of rehabilitation procedure.
Okay, welcome everybody on the second part of our session. Now we will have the practical session according to the assessment and training of human balance by using the static conditions on the static platform. Here we have a patient, Angelica, welcome.
Hello.
So you will be our patient. Okay, we'll do the assessment and training of the human, of your balance on the platform. Okay, so this is the Alfa platform. So before starting the assessment of using the stabilometric, dynamic or Y distributing test, the position of the feet is really important during the assessment, okay? Can you step on the platform, please? Okay, first of all, the center of the lateral malleolus should be on the red line. Then we look for the position of the calcaneal tuberosity, okay? So here we have the position of F4 for the left and the right lower extremities, and then the position of the medial part of the foot. So here we will have 10 degrees, okay? So this is your position for the test. First we will have the assessment and then we will have the training, okay? The stabilometric and then the dynamic and the weight distribution tests, okay? So I will explain to you the tests before applying, okay? So first of all, this is the stabilometric test. Your aim during the test will be to keep the green point, okay, which is the central of pressure in the crossing point of the longitudinal and the vertical axes, okay? We'll do the 30 seconds test. Okay, so we can start the position of the feet, okay? So the medial part of the feet and the position of the calcaneal tuberosity. Okay, so you stand normally and we can start. So for 30 seconds you try to keep the green point in the point crossing the vertical and the longitudinal axes. Okay, so we can start and you try to keep this point. During this test, we have the biofeedback information from the graphical view and also the numerical data. Mainly we look for the path length and the area. If the results are closer to 0, these are the better results for the patient. And normally we have here the 30 seconds test. Okay. After the test is finished, we have the results. Okay, so we can go to the report. Okay, first of all, you have the report from the stabilometric test showing you the information about the patient, then the graphical view, the numerical data of the assessment. Here we can see that the patient moves the green point according to the central of pressure more to the posterior and left quarter, and according to these results we can apply the specific exercises for the patient. But we have also the multimedia report here, so we can also see the graphical view and the position of the patient on the camera during the whole assessment of the 30 seconds test. So you can see that the patient moves the central of pressure more to the posterior left quarter. And as I mentioned, according to such a result of the test, we can apply the specific exercises for the patient. Okay, so you ready for the exercises? Okay, so according to the assessment, we'll do the 2 exercises for you. Okay, good. So we're going to the exercises. First of them will be path. Okay, so we had some problems in the posterior left quarter. So we'll apply the exercises for the anterior left quarter just to compensate, and after we can also make the second assessment just to see if there will be any better results than the before test. Okay, so your aim will be to go from the first circle to the fifth. They will be highlighted going from 1 to the 5. Okay, so we can start the exercise. So you go from the first to the fifth circle. Okay, you achieve the first one, the second one, then the third one, okay, the fourth, and the fifth one. Okay, and we can do such exercises. So you still work in the one quarter, so you compensate the results from the test, yeah, that was before. Okay, so this was the first exercise for you, called the path. And now we'll have the second, called the stability. Okay, so we have also 4 quarters, yeah, and these circles. And your aim will be to keep this green point in the B circle, quarter or circle. Okay, so when I press start, you try to keep in this area, okay, for the whole exercise time. Okay, and you try to be on this area. So we are in 1B, yeah, part. Okay, and you have also the results during the test which are shown. So according to the assessment of the stabilometric test, we had 2 exercises, yeah, for the patient. Okay, and after such exercises, we can also do the second test, the second stabilometric test, just to compare the results from the first and then the second one. Okay, so after the stabilometric test exercises, we'll go to the dynamic test, which is also called the limits of stability test. Okay, so now we will assess how you change the position, how you move the center of gravity, so this green point, from one target to another. Okay, so when I press start, your aim will be to achieve the targets going from 1 to the second and then coming back to the center. So we'll go from the center to the external point, coming back to the center, and then the next external point. Okay, so you ready?
Yes,
Good. So we have the position of the feet, and now you achieve the highlighted targets. Okay, so you start going to the center and then to the next highlighted point. Okay, and you try to achieve all of the targets. So we can assess how the patient moves the green points, so the central of pressure, from one target to another one. Okay. Okay, and after the test we have the results. We can, okay. So we have the report. Okay, one more time. You have the information about the patient, the numeric data, and also the graphic view from the test. And we have also the multimedia report. So you can also see the view from the camera and the points which were achieved by the patient during the test, and the changing of the position of the patient during the assessment of the limits of stability or the dynamic test. Okay? According to the test, if you imagine the patient has some problem in one path, we can also apply the specific exercises for the patient. So now we will do the exercises according to the dynamic test. Okay? There will be also 2 kind of exercises that we want to apply for you. Okay, so we go into the exercises. Pendulum will be the first one, yeah? So your aim is to go from one extremity to another one, but you have to move the green point with the gray circle, okay? So it gives you the speed of the path going from one extremity to another one, okay? So we'll press start and we'll start the movement. Okay, so you try to go with the gray circle from one to another extremity. So according to the results of the dynamic test, we can also change the angle of the pendulum. We can change the length and the thickness, but also the frequency. So so we can apply different elements according to the results that we achieved during the dynamic test. Okay, so there were 2 exercises for this assessment. And then we can do the second assessment of the dynamic test just to compare the results with the previous test. And the next one will be the wide distribution test. Okay, so your aim will be to stand looking forward and we will assess the distribution of your left and right lower limb for 30 seconds test. So we have the position of the feet and we can start. Okay, you just look forward and here we can see the distribution of the load during the test for the left and the right lower limb and the information about the average load for the left and the right leg and also the information about the time of the left and right leg average load. And also we have 2 triangles, one according to the left and the second for the right lower limb. Okay, after the assessment we have the report about the patient, but imagine that we wanna put more load to the left limb, okay, according to some problems of the patient. So we can go to the exercises, to the wide distribution, and we want to have more load distribution for the left. Okay, so your aim will be to keep the peak of the triangulars in the shapes of the rectangulars. Okay, so we press start and you have to put more pressure to the more load to the left and you try to keep in the sizes of the rectangulars. Just to increase the difficulty for the patient, we can also we can decrease the tolerance, so the size of the rectangular, and now applying the exercise. Okay, so you also try to keep okay. So by decreasing the tolerance, is more difficult or easier? It's more difficult, yeah? Okay, good. So there were the examples of using, as I mentioned, the stabilometric, dynamic, and the wide distribution tests. So we have the tests, and then according to the results, we have the specific exercises. But also here, we can measure the Unterberger test. The information about this test was presented by Roman. Okay, so step backward. Okay, so your aim after pressing yes start will be you will close your eyes, do the hands like this in the front. Okay, and step for a couple of seconds. Okay, good. So close your eyes. Yeah, hands in the front, and we can start. 1 second. Okay. You can step? Yes. Okay, thank you. And here we have the results of the Unterberger test. Also here we can apply the body mass index or the gains. Okay, so this was the practical session. For this session we use the screen here, the bigger one, but normally these are the elements, the components that were presented by Roman before. So thank you for your attention for this session. Then we'll have also the practical session of the second and the third stages of rehabilitation, so by using the Gamma and Sigma platforms. Thank you very much.
Welcome everyone on the second part. In this section I will present you the software supplied with Alfa platform. As you can see, this is the main window of the software. On the left side we see the database of the patient. On the right side we see the box with settings of exercises and tests. The lower part contains modules which can be chosen, tests, exercises, games, patient database and reports. In the middle part we see the biofeedback information for patient. And during the normal work, this part of screen is visible on the second monitor dedicated to the patient. The outer elements of the main window is visible only to the therapies on a laptop. The middle part represents the base of support, and the green point in the center represents the center of pressure, COP point. And based on the movement of this point during the tests and exercises, we can evaluate the condition of the patient's sense of balance. The software allows you to perform both diagnostic and exercises. Available are 4 diagnostic tests and 7 exercises. First, a fundamental and well-known test is stabilometric test. In the settings box we have several options. We can choose the test condition, eyes open, eyes closed, or combine both of these options into the Romberg test, also known as drunk driver test. The exam is based on premise that person requires at least 2 of 3 following senses to maintain balance while standing: proprioception, the ability to know one's body in space; vestibular function, the ability to know one's head position in space; and vision, which can be used to monitor changes in body position. After the test and during the test, the therapist can observe few parameters such as average deviation and average velocity in frontal and dorsal plane X and Y. Additionally, also the path length and area marked by the COP movement. Higher values of these parameters indicate the patient difficulties with balance. Additionally, therapists can evaluate the Romberg Indicator, which compares the results from tests with eyes open and eyes closed. Significant difference between the test results under different conditions suggests disorders associated with somatosensory and vestibular function. Of course, in the settings box I can choose also the test duration time, 30, 60 or 90 seconds. I can show path to my patient. I can hide my patient screen to make the test more objective. I can save also the movie which is recorded by the camera. Another test I can perform is a dynamic test. Dynamic test, like the previous test, is used in orthopedic and neurological rehabilitation. Additionally, it's also used to evaluate risk of fall of older people and in sports. And the exam is based on premise that the maximum body sway value that person can perform without stability loss doesn't exceed some predefined limit. The task for the patient is to achieve highlighted by yellow color targets in shortest possible time. and in shortest possible way. The therapist during the test and after the test in report can observe parameters like here: path length, path completed ratio to path minimal. Path completed is a path generated by the patient, and path minimum is the path generated by the software, straight line between targets. Additionally, we observe here how much time patient spent to achieve targets in each quarter: top right, bottom left, top left. We can choose also here a difficulty level: easy, medium or hard, and test duration: time 30, 60 or 90 seconds, or in repetition. If I choose here repetition 1, patient must achieve each target once. Of course, I can show the path and save the movie or add some notes. Another test I can perform is weight distribution test. And these two green triangles represent the loads on the left and right limb. When the patient directs 50% of body weight on each limb, these triangles have the same height. Of course, we have a few options here. In the setting box, we can choose here test duration: time 30, 60, 90. I can hide the patient's screen to make that test as the most objective, and also we can add some notes and record the movie. We observe the parameters such as left, right leg average loads and time of left and right leg average load. And the last test we can perform using the platform Alfa is Unterberger test. We can use this test for determination whether the patient has a vestibular pathology. During the test, patients are making step in place with eyes closed and with hands straight to the front. We evaluate how much patient will rotate around its own axis. Rotation over 10 degrees means that the patient needs additional medical consultation. Of course, after each test, we have a report. I go to the report module, and for my patient, I have here some reports. For example, John have Romberg test. On the top, I see the basic patient information, settings in the test. I see two plots, two graphical representation of COP movement with two different conditions: eyes open and eyes closed. Here is the path, and I have the numerical data about average deviation, average velocity, path length, and area marked by the COP point, and ratio between path length with eyes open and path length with eyes closed, and also the ratio between eyes open area generated during test with eyes open and area marked by COP point during the test with eyes closed. Of course, two plots with X and Y axis deviation. I can go to the multimedia report here, and I can play a multimedia report. The time is moving, path is generating, and if I have a plugged in camera, I see here a view from camera. Okay. I can go to another report from dynamic test. Okay, numerical data here, time to achieve each target, path completed to minimal path, path length, and elapsed time 22 seconds to achieve each target once, and the graphical representation of COP moving during the tests. Okay, here I have also the results from dynamic test, Mr. Marcus, and we can simply see the difference between these two patients. Path length is here 382 and here 170. It's a big difference. We can see this in the numerical data and on the plot. You can see also that Mr. Marcus have a bigger problem with to achieve targets in top right quarter. When we have some information after analyzing the reports, we can go to the exercise, and for example we see that Mr. Marcus have a problem with the top right quarter. There was the bigger time to achieve the targets. This is exercise pendulum. The task for the patient is in this exercise is to move the green point, which represents center of pressures, inside the gray reference circle, which is moving from one pendulum extreme to another. I can adjust the exercise for patient needs. For example, Mr. Marcus have a problem with top right quarter. I can rotate the pendulum to the top right quarter. I can change also the thickness for sportsmen and for patient with bigger problem with balance. I can change the length. I can change, of course, the angle, and I can change the frequency, the speed of the gray point. Of course, the test exercise duration time from half minutes to 5 or in repetition, or no limits, where the therapists decide when the exercise is finished. Another exercise I can perform is a path. The task for the patient in this exercise is to move the green point to the highlighted by yellow color targets. At the begin, we must to create the path. You can do this in a few different ways. You can use the open path. We can choose some available path, and we can use this available path. When I go to the create path, I can change a little bit the path. Simply change the target size and I can change the target activation time. This means how many time patient must spend with the center of pressure point, green point, inside the highlighted by yellow color targets. I can also enable or disable the any order mode. Okay, the second way is generate the path. Simply put here some settings. For example, I want the difficulty level hard. I want 11 targets, and the target size will be 3 centimeters. I can also choose here the preferred area, and I set for Mr. Marcus. Mr. Marcus have a problem with the top right. I put the 100% of target will be on the right side, and I can simply click generate, and every click means a new path. This gives me the opportunity to generate endless numbers of paths. Another exercise I can perform, I want to show you, is tracking. This is the tracking. And the patient task in this exercise is to move the green point, center of pressure, inside the smallest circle, which is moving around the bigger circle. Of course, some parameters which give me the opportunity to adjust the settings, the exercise, to patient needs. I can change the target size, I can change the path radius, and I can decide where the big circle will appear. For example, if somebody has problem with top right, I put the exercise to the top right. I can change also the target velocity and rotation direction. Of course, it's very important that results from exercise can be also saved to the report, and after some time we can compare the results, and we can say that our rehabilitation go to the good direction. We have also here a patient database. You can add some information, basic information about our patient, sex, height, weight, date of birth, last name, first name, of course. We have also a module, body mass index. Simply put here information about the height, patient height, and we have the BMI, body mass index value. And last thing is the game. Nice colorful games. The patient here is driving the ball, and when the patient put more loads on the left side, the ball will turn to the left side, and when a patient put more loads on the right limb, and the ball goes to the right. Of course, 3 different difficulty level: easy, medium, hard. Easy, medium, hard. Hard means that the curves will have small radius of the curves. 2 different ways to decide about the speed of the ball. First, if when patients stand more forefoot, the speed increase, and second option, if patients stand more erect, the speed will grow up.